Yeah, man, we're up. All right. Me have to do a little follow up on the baby mother who lost her life over there in a Port Antonio hospital, yeah? Because somebody right I tell me about, the doctor and them and a God and them thing they name the thing what happened to her the other day is a hemorrhage, yeah? It named postpartum hemorrhage. I'm going to read about it now. Because everything you can read about, I want to know if I negligent or something. Because we don't have foolishness, Saying? It tell us, say, in a most country, most of the time when people dead after them thing, after like third world country and them thing, they say, don't show you. But we're going to show you how it can prevent and all kind of little things. Because when a doctor, when a nurse and them thing, they will never have a crew, they don't study these things. And what I want to say, what I point out, if this young lady leave her house 4:30 like her mother say, and her sister, that means she'll reach something to 5. And have baby after 6, that have like hour and something. She have baby. Never baby that is dead, baby that take longer to come out. You can just look it up how long baby dead in a woman, how long baby take to come out. Because you can't find everything now, You can't look it up. She know just go and a baby like that. Some people gonna live up 24 hours. See? I'm better feel now with me in a theater too and deliver my kids them too. So, me in there. Gynecologist, me right there so. Me follow up these kind of things. I like follow up them things, like some other man me cut me a bit string and them things there too, man. You understand me do everything, man. So I put up some picture with Korean. But we have other picture I want put up with Zoe and them, man, I don't want him to put up the one with Korean and thing. But me inside of the room. Yeah, because I remember me not use for them kind of public thing where you can't go and you can't see what I want and I have to say everything, I have to know what I want. Like a doctor, Play my role too. You see me I say? Alright. So I could just follow this. I could follow this and never finish talk about that now. I could see what I want here. Because the man drop out. So we want to see them thing here. And Jamaican ladies too, when we start people around the world, when we start read up them thing here too, Especially pregnant mothers and them thing there. Postpartum hemorrhage. What is postpartum hemorrhage? Postpartum hemorrhage is more bleeding than normal after birth of a baby. About 1 in 100 to 5 in 100 women have postpartum hemorrhage. It is more likely with cesarean birth. It most often happens after the placenta is delivered, but it can also happen later. What causes the hemorrhage, the postpartum hemorrhage? Once a baby is delivered, the uterus normally contract and push out the placenta. After the placenta is delivered, these contractions help put pressure on the bleeding vessel in the area where the placenta was attached. If the uterus does not attract strongly enough, these blood vessels bleed freely. This is the most common cause of postpartum hemorrhage. If a small piece of the placenta stay attached, bleeding is also likely. That means if a small piece inside it still bleed. Postpartum hemorrhage may also be caused by tearing the cervix or tissue of the vagina, tearing blood vessel in the uterus, bleeding into the hidden tissue area or space in the pelvis. This mass of blood is called hematoma. It is usually in the vulva or vagina. Blood clotting disorders, placenta problem. Who is at risk for postpartum hemorrhage? Some women are at greater risk for postpartum hemorrhage than others. Conditions that may increase the risk include placental abruption. This is the early detachment of the placenta from the uterus. That means it can detach itself from early. Placenta previa. This is when a placenta covers or is near the opening of the cervix. Over distant uterus. This is when the uterus is larger than normal, because of too much amniotic fluid, a large baby, multiple baby pregnancy, high blood pressure, disorder of pregnancy, having many previous births, prolonged labor. But she never prolonged labor neither, because she give birth quick. Infection, obesity. Use of forceps, vacuum, assisted delivery. Being of Asian, Hispanic, ethnic background. What are the symptoms of postpartum hemorrhage? Partum hemorrhage. These are the most common symptoms of postpartum hemorrhage. Uncontrolled bleeding, like what them say with the young miss. Decreased blood pressure, increased heart rate, decrease in red blood cell count, swelling and pain in the vagina and nearby area. If bleeding is from the hematoma, it's from the hematoma. The symptom of postpartum hemorrhage may look like other health condition. Always see your healthcare provider for diagnosis. Postpartum hemorrhage diagnosis. Your healthcare provider will review your health history and do a physical exam, lab tests after help with the diagnosis. Other tests may include estimate of how much blood you have lost, measuring pulse and blood pressure, red blood cell count, clotting factor in the blood. And the more I know you treat it now, how you treat. The aim of treating a postpartum hemorrhage is to find and stop the cause of bleeding as soon as possible. Treatment may include medicine, uterine massage, that I like under the navel, that's where you rub under the navel, massage it, yeah. We know that, that's a fact. To stimulate uterine contraction, removing piece of the placenta that remain in the uterus, exam of the uterus or other pelvic tissues, the vagina, the vulva to look for areas that may need repair. Backward balloon or colony catheter to put pressure on the bleeding inside the uterus. Your healthcare provider may pack the uterus with sponges and sterile material. That may be done if a backward balloon or colony catheter is not available. Laparotomy. This is a surgery to open the abdomen to find the cause of bleeding. We don't see nothing like this. Tying off the sealing bleeding blood vessel. This is done using uterine compression sutures. That are the sutures. That are like when you stitch. There's some stitch in the sutures. Special gel, glue, or coils. Surgery is done during a laparotomy. What is? Hysterectomy. Hysterectomy. This is a surgery to remove the uterus. In most cases, this is a last resort because you can't move that if you have bleed, too much on them thing there. Replacing last blood, the fluid, is important in treating postpartum hemorrhage. You may quickly be given IV fluid, blood, and blood product to prevent shock. Oxygen may also be help. So you can start getting back transfusion and all that kind of thing, Yeah. The hemorrhage can be quite serious, but when your provider quickly find and treat the cause of bleeding, often you will be able to recover fully. Simple. See? So me not believe in a when we watch and it continues and it tell you have an injection and thing where you can get and everything about the whole things, yeah. So me not believe when I watch the thing there when I show the thing yesterday. Yeah? When the mother them I say the nurse them I say she just bleed too much and them couldn't do nothing. Hospital that. And most hospital they have a team. And if somebody have baby after 6 and dead after after 3 hours. Not never them never do nothing. In other part of them I tell them if you put up your foot, try make them breathe, try and you use different things and different method, or you go into the surgery or do something. Cause in more first world country, you know find people that's dead for this so easy. I'm more in some third world country and thing because them not follow certain procedure. So it's simply call it negligence. You see what I say? So when me watch all the mother I make the plea yesterday. And when I put up the thing, I see the man, I make the play, and some people they say, but the man got no, you have, let me tell you this. You have some people, the amount of shot them get and them survive. Them a bleed all over and you have to go bust them open and you have to go find it all about. You have some people sit up and thing and mash them up. Some people get shot to run through, them back they come through and tear up this and a be a bleeding seam and bust up some vest and everything. And them work on them not dead. I like have a baby is a death sentence, so she just bleed and you just lower and make she bleed out. So, for 3 hours. She got dead because she lose too much blood. And not and then most of our hospital, they tell you the truth, and the first baby mother dead like this. You understand? Most of our hospital, when people are baby, nobody not dead for look upon them depend them own. You hear it more than one time. I remember going to something bigger than that. I think a Clarendon woman did have a baby. And the other day she get a right baby. And this can be very dangerous. The woman have a baby, them tell her say it's a girl baby. But yesterday when she ready for go home, them give her a boy baby. She say, you know, call them never show the baby, them tell her it's a girl and what have you, you know. She them look about her and then a woman know we have a boy as a girl, them give she. And for almost around 2-3 years that I go on for. Because she carry on the boy, but she wonder, you know, or them tell her a girl and what have you. And when you look now, it's a mix up in a Clarendon hospital. But look how the mix up can see us now. Can you imagine she carried a baby there to the man and say the man migrate go somewhere and them go do DNA. And when the man do DNA, it no come back right. The man can blame him wife now and lady say, hey, it's a jacket this, you know. And I know say that switching the go from hospital. That's our public hospital. Look how serious that is. See? Now, you have some breaking up all kind of things happen. That's up. Because him no know so well and she no know say, oh, the right baby. Can you imagine if them is not a, you know, change the sex but at the same sex and them gone girl and then mix up that. I never put the tag and mix up your baby because them have them there and keep them. I say you have to use private place. See? You understand? Me can tell them say in America different and in Canada different because in all Canada now your baby never come out of your sight. Never. Them not take your baby like like them in a jubilee and then put it. Your baby in a room with you. Them do but unless the baby did come out sick or something, the baby from them do everything, you have the baby go straight into the room with you. With the tag, them make sure put on. And matter of fact, you can't even go through the door with the baby. Because the elevator can shut up and everything because the tag have a sensor thing on it and them thing there. But the baby not leave you. So not like them swap your baby. Not leave you. You have an tag to and the baby have an tag and mother have an tag. Tell me I tell you. In the States same way. You can't, you know, if you go just exchange up a baby daughters. You understand? Remember me have my son and daughter about US and Canada too, you know. So you understand? So me know me I talk about, eh? So when I guess, me I guess. When you see them, when you don't even know, me I tell them. See? So these are the things that me I tell about and the kind of treatment different. You understand? And then I look out for everything and every test for run and everything and make sure you're alright for it. See? So these are the things that we talk about. We have to sit down and talk about. When somebody said, the doctor don't know, we have to change up them things, the man. Can't be just some midwife and if you're getting something like this, please have placenta leaving and them thing there, uterus, you have to massage, right? And the neighbor, you know, you're not contract, you know, strong enough. Can't bleed out too. And all kind of things, and you have to show what them for do. So you when the family if you ask if them did I do any of these things and show them because if you try to save her, put up her foot, try to save her, she'll be safe. Not a death sentence like that. Like what them attack. You understand? No. See, there you have nothing about it and just get up and read about. Just get up and read about it. You can't just get up and just read. Just put it in and read. Just put them in and read about them, man. Every little thing you have to start study about them thing there, no matters. When you have baby, when you can't just make them get up and you have some nurse and business and some doctor. Because right away, she have bleed from them, see that them that girl check and them are check upon her. Them leave you upon a bed and you sit down by yourself. And nobody now come look for you, maybe tell her, when they come back and look for you, maybe you're dead already. That's a joke me I make. That ain't joke. You understand? And we need to change that kind of style, you know. It's so wrong. It's so wrong. Yeah? So when them hear them thing about, you know why them get away these things? Because see there, how to prevent postpartum hemorrhage. You can't just read them up and it will show you can see them and read them up. You understand? See? Doctor don't know if you do and follow that and if you move fast and do what you do and show people on the 3-hour window. Never have dead. Never have dead. And if them say the baby dead now, you have wonder because you have breach. Baby can ban breach, you can ban footways first and then you still have to run going on in a surgery. So you must have them surge and they ready or something. See? Because something can complicate or something and baby not turn right and a ban and when you look at footways and you have to do some boom and do a cesarean fast and thing. But the mother that are dead because she have to wait for now, maybe the crew now for come and all kind of things and prepare. We should have prepared it from she go down in labor, you must have something prepared up. You understand? Them now do the right thing. When if you start do the right thing, enough mother lose them life. And nobody feel no way, me know people personally lose them life after them have baby. They are rock foot, me go the funeral too. You understand? After she have baby. Me just I look pan her right now. Don't I that church and put a little dolly side her and thing I look pan her. So after she have baby, she seeing them bleed out. You understand? So me know people dead from it. See? So I know something pretty. You understand? I know something pretty. Me know a person dead from it. See? Yeah. So them thing about when you can prevent it, we have to start do something to prevent these kind of things. You can't buy with the food thing. Don't make no sense. You understand? Yeah man, can't deal with that. Cause this too, you see me I say? Yeah man. Yeah man. So people, enough baby mothers and thing, woman on the look on them thing here. A matter of fact, when I go doctor, if you don't feel some pain, you have to start look up some things, man. Don't wait for them for diagnose, you know. When them not test, you know, them just put the little thing there on you. Put them little stethoscope on you and tell you say, hey, you have this. No blood test, nothing at all, them not do no kind of test. And then just tell you something and them just give you injection. Me not take injection, so. Me have to know what happened to me. Me refuse these things. Saying? So if you know the blood test and me know so this happened to me and me show me the result, you know. Okay, you can't tell me nothing, you know, you can't just joke me as I like or do anything and give me any medication. Me have to read them up and see the side effects and see where it's good for where you treat me. Serious. You understand? This is just me. You have some people, they made a tear off and anything and a nurse come and joke you. The doctor just say, give him that and speed up all the heart or do or something. You don't know. You just get a joke and you just, you know, dead or cripple up or something. See? In Jamaica, you nobody in a doctor now. You see them with a doctor now with a corrupted country, I hold them for all kind of things. In the state, you have some doctor, them come and them after people hold them, after them get old, authority hold them, they used to them kill 300 people. And nurse do it too. Them just go in and just make it a serial killer them. Nurse and then just go give them somebody injection and do something. See? You understand? So you're aware of these things. But in Jamaica now, nobody now get account for nothing. Guy now get this bar, you know, doctor now get charged and then, you know, them struck him down from the doctor registry and send him a prison or something, and nurse now get, you know, the same thing. So them just kill, you know, me I tell them just do what them I do. If you're dead, them just write say this kill you. And then we accept it and then get over with it. Time for that change. 2021 now. See? And the world intertwined now. So people, you know, when I start read up more and start studying about things more. Yeah, your back hurt you want to know, you just go and a man put a stethoscope and you just listen and just say, boy, you have a slip this, and him not do no CT scan or nothing at all. Him just say you have a slip this, you know, because you need this and that, and you need an injection, zoom. The later all part of your bend up and all kind of things. Me not work off of them thing there. Me not work off of that, man. You see? When you go to doctor, the first thing doctor do you, they might do blood test, they might do ECG, then them do them if they want to do scan if a chest or anything, because they might look if you say the chest and thing, they might look if it's a heart attack and them thing, they might try to stabilize them before them put your triage, right? Triage. For them put your triage, them just them all see which part to come, them all assess you first. But then make sure you stabilize in a certain way. For something more serious, them just move it faster than that through the whole system. You understand? In Jamaica now, you just sit down, and when you sit down, man go to Spanish to the hospital, and his mother feel it fear. She go there and the man say, Mom, you're dead, you know, the way him bed hurt him, and him dead, them throw a sheet over him. From around 7 o'clock the evening, and at 9 o'clock the next morning, them call him name for just see a doctor. When them go touch him, it's a dead man in the hospital, and the hospital and get sued in Jamaica. And the first. It's not the first. People stay in a wheelchair and drop out a wheelchair. The woman drop out a wheelchair and must be dead. The car head and dead. She go to the hospital and that happened to her. These are stupidness. You understand? Them things are stupidness. So them things are what we have to burn. When we say burn, we have to burn them. You understand? They need to burn. You see me I say? You see me I say them things I need to stop. Them things we need to burn them. You understand? Them things I need to burn. You understand? Yeah, man. Yeah, man. Them I need for burn. You understand? So people have to take on health in our own hand. Me just go and run down on my backbone and them things. So these are the things when I tell you, when me go to doctor, you can't just get up and come joke me so and them things there. And them kind of little thing here, me I tell you, them kind of little thing here, negligence. So the care when I say, oh, them couldn't, of course, say that the doctor, oh, our blood pressure gone up. Oh, the baby dead too. And then the people them just put on our bag and just carry away. Like, what people them have no value. Where we get where this come from? Me I put up this everybody see too. When you start read up on things, man. See? Don't bother take no talk from them and when you read up on I say, okay, that means she'll have a chance to survive and I like she lost to some woman dead so. She'll baby so fast. Some people take 20 hours. Some people are next year going and labor and how much percent reach and how much when we reach around 5 when them call it 5 when them call it centimeter 5 6 7 when they reach 8 9 then 10 them are going in a labor room now for go see so them watch all your cervix are whooping 1 centimeter, those they reach 2, those 3. So them all these things them check out on them things. Nobody feel so we don't know what did them man. But did them man they not delivering room more than once, man. More than twice to man. You see me I say so and I like me not know, me not go through them thing here. With wife. You see me I say so when you see them LK kind of thing, I say we have to just channel. Government. You have to make sure we provide health care for the people them. Proper health care. Most hospital names have doctor there. And there's some little nurse run up and down. If you think a joke, go to public and look on the ward. When doctor run ward in the night, if doctor run 8 o'clock, tomorrow man 8 or 10 o'clock before you see doctor again. So what if somebody getting a difficulties, one nurse stand up like is a prison camp, Nancy camp, and them have a little station, nurse station, where them just look. And when you look, you say, maybe they don't want a public right now. Maybe I say all 100 people. Pan a ward. They don't know if one nurse can do something. Have them put an extra one with a little book. And then when the nurse come now, if you get an injection, she just come and look at the time and give a pill for take her, come juke you. And you never know what kind of injection I might give, you know. So sometimes it do more harm than good. You understand? And then put a little juke with little glucose water. Just put it on your things or something. But because see, they want to put the medication in the bag now, and then just put something, maybe dehydrated, so them just, I try, you know, hydrate you still, but them just do that and leave that in your hand, and then them go about them business, and you have been up with paid a nurse, you think nurse will come to you. I tell you, it's barbaric. It need to change. It need to change. The mother them suffer, and can you imagine a woman who have mostly in them where they deliver what are mostly woman nurses. And when a woman, and if I want to have a kid same way, we have to do better than this. We have to do better than this. You understand? And we must have a doctor team in a them place when people give birth, and we not check them, they just give birth, and you say, we don't know if the placenta tear off, we don't know if this and that, because that show you. So you can say, all right, she'll bleed too much, but we call the team right now, for Russia that we put in these methods. But tell me what, but hospital them never have medication and them things neither. Believe it or not, because most I think you have to buy it from outside. You will get this maybe for their andrews because you have to spend $100,000. So you get any little thing, them carrying anything and you're good. Operating theater always ready, everything ready. Ready to go. You understand? Ready. I tell you this. I see my granddaughter got born and my son did my granddaughter got born, and in a space of no time as a cesarean. They were planning for right away them just zoom and just move from that. I said, oh nah, boom cesarean. Up and running. Everything good. Same time. But a private hospital. So private hospital, you know, say I one bag of money, but the doctor them ready and them good. Yeah man. We don't have nothing is like it there. Round there so. Yeah man. I grew up nice man, healthy and good. You see what I say? So them just do what them have to do and fast and everything's smooth. One smooth. Them no itch. You understand? But you must have the team, because if somebody have a baby a born breach, foot come out and that means the shoulder are stuck and might have born away. You have to rush that person in a theater or something. So with them doctor, you cannot have midwife in their place. Or some doctor when they can't even do operation or something. What is that one in Jamaica? Foolishness, man. Yeah? When you hear them people are dead, lose them life. Eh? A matter of fact, she remember say she have 2 other kids too. She have one at 16 and one at 10. So them they are good out mother right now. And the one and the baby there. You see me I say? So it bad. It's still bad. It's so bad. You understand? It's so bad, man, for burn it. So more all of them lady when they're pregnant, I think when they start read, instead of follow foolishness, start read up on all these things, the possibility. Just read up on these things. It's better for you. Just sit down and read up on these things. So when there's some sign and I say, when they just tell the doctor, say, I think it's this happening, you know, and I know so when they're supposed to do this, you know, and give me them injection, you know. Because see there, in a birth, you have injection for these things. Routine. Alright, see the injection, yeah? So some of the injection where they use to prevent some of the things, yeah? Injection, see that? Prevention. See one of the injection, eh? Hospital birth centers. Routine, see there? Penicillin injection to help ensure that the placenta comes quickly. So them use injection and them use something. And them have things where them use and cure them things that one your injection. One where them gain in your belly. And then you rub down to the uterus there so. You know? Make it contract better, you know? And it help you. You see me I say? It help you. See? So them things are things where, you know, people feel, you see the cars there. Them things are where people feel start risk factor. Yeah, and you see me I say? It tell about them. It's there. But it does show us mostly in a certain country, you know, poor class of country, you find out that people die. Because in the rest of the country, them know what about doing them now, you know, just get up and dead so. You know, make it dead so. You understand? So I have to do this. Me have to do this for the ladies, them pregnant ladies, them wife, they and them think they wanna understand this and in there and lie down and on a nurse, you know, for be more, come on, man. For be more mother-like now, man. When I deal with our own species, man. Can't deal with people, so man. I'm not a fuck when I get paid for doing the job. When I'm supposed to love on the job. And you can't sit down there. Because it happen all the time. It happen at Jubilee. It happen enough more places. So, alright. So, a baby mother in Hanover the other day go have a baby. She end up dead. You know, you don't say them no, the mother don't know how she end up dead. And Hanover, it come on TV just the other day. But it happen all over Jamaica just like that. You go in the way, yes, a baby dead, mother dead. I never know how them end up this way. See? Because if it's a risk factor for you to say, okay, oh, them that's if you do a surgery, oh, them not do surgery right there, so them couldn't do the surgery to take the baby. So she did there and the two of them end up dead and something. That's a joke. You understand them thing a joke? Eh? Oh, we not do surgery up here, so, so if you not do surgery up, they say can't have people have baby, they say they not do surgery. You have to have a theater right there. You can't breach or anything where you do. Oh, I could get a car and put her and carry her maybe 20 miles away. She can dead pan the way. What kind of foolishness this? Needs to Jamaica go back where? When you wake up, man. Baby mothers put this out for Uno. Wife and them thing put it out for Uno. And doctors at time for Uno start face some jail time too and some on the nurse. When you do this too, nobody not pay. No pay, no penalty, no price of these things in Jamaica. When you continue to do the foolishness, it's time for it to stop. There, you know. Rolling some. Keep it up, yeah? Wow.